Hi, my name is Dr. Ilya Skolnikoff, and I'm excited to be here today and to talk to you about acne. I'm a diplomate of the International Board of Apply Kinesiology. Apply Kinesiology is the study of the interrelationships of the body. Every organ is related to a different gland. Every gland and organ are related to a different bone in the spine. Every gland, organ, and bone in the spine are related to a different emotion. Every gland, organ, bone in the spine, and emotion are related to a different nutrient which supports those emotions, glands, and organs, and bones in the spine. And they're also related to different homeopathic remedies, and they're related to different note of the scale. There's 7 notes in the scale. They're related to a different color. They're related to a different acupuncture meridian. They're related to a different reflex point on the body. So there's all these different relationships. And applied kinesiology is an applied kinesiologist is an expert at understanding how to know what's going on with a person's health by looking at laboratory analysis differently, and by looking at how a person walks and how that is able to reveal information about their health, how they talk, how they stand, how they breathe, how they swallow, how they sit, and their facial complexion, the structure of their face, by checking their traditional Chinese medicine pulse points. All these different things give huge amounts of insight into a person's health and body. So what does this have to do with acne? It has everything to do with acne, my friends. So the thing that's so mysterious and strange about acne is that most of the people who are treating acne just completely ignore the cause of acne, and instead they treat the symptom, or they aggressively attack the underlying cause by treating only one cause, and that's chemical, and they'll treat that chemical cause with a medication that, say, will shut down the liver and prevent it from metabolizing fat, which is really, really dangerous and can cause pain in different parts of the body. It can cause a person not to think clearly. It can cause a person to have trouble with bile metabolism. It can cause a person to have their cholesterol levels go haywire. It may not be such a good idea. And I'm referring to Accutane, my friends. So let's back up a bit and go back to the beginning. I got started as a healthcare provider because I had severe acne. I was just a kid. My father was a medical doctor, and so we went the medical route. First we tried benzoyl peroxide, then we tried the Stridex pads, then we tried it was similar to a Stridex pad. It was something that had it's a chemical called salicylic acid that helps with pain and inflammation. None of these things were working too well. We tried something else called Redin A. We tried something else called tetracycline. We tried something else, finally, called Accutane, and it worked great. My skin became acne-free. Instead of having 3, 4, or 5 eyes, I only had my 2 eyes. Okay, I no longer had the craters all over the face. Before, I'd had cystic acne, couldn't really get a date. It was horrible. The emotional impact was just terrible. And now things were going better, but as soon as I started taking the Accutane, I started seeing floaters in my eyes. I was starting to get angry all the time. Within 6 months to a year after I took the Accutane, I was like yelling at people all the time. It changed my energy. When I took the Accutane, my skin would get really flushed. I would get really red skin. It just was a nasty, nasty thing. So I've known people that were completely dysfunctional after taking the medication. So what they're not telling you about the acne, that nobody seems to understand very well, except for me and maybe a few other people that are highly trained like I am, is that there's a definite cause to your acne and there's a definite solution. The most common things that cause a person to have acne, and the most common age for acne, of course, is adolescence. Men tend to get it a bit more than women, and it's troubles with vitamin E metabolism. Vitamin E metabolism may not sound like a big deal, but the acetyl groups are necessary to make choline. Choline is a neurotransmitter needed to help a person to calm down and to relax It helps the heart to relax in between the heartbeats. It helps a person to sleep well at night. It helps with fat metabolism. It's a B vitamin. If you have an imbalance in any B vitamin, you end up with problems with lots of things like the stomach and the heart and the skin. Does this sound familiar? So that's one big deal. The other thing is that vitamin E is needed to make estrogen. Vitamin E is needed to make testosterone. When a boy is growing very, very fast, around 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, especially at the higher end of those numbers. So 14, 15, 16, 17, 18, or maybe 15, 16, 17, 18, 19. Their testosterone levels go way up, so they require far more zinc, vitamin A, vitamin C, and vitamin E. And without the precursors to make testosterone, zinc, vitamin A, vitamin C, vitamin E, they end up with some trouble. Now, one of the troubles that they end up with for many people, not everyone, is the acne. Now, there's a few other things that one should think about. We're living in a toxic world, okay? So a lot of people are just so toxic that they end up with some problems. So toxic colon, toxic skin. The skin isn't, you could think of the skin as being directly connected to the colon. It's not that it is, because it's not, but you should think of it that way. Because the skin is the outside of the body. It's the largest organ in the body. And the colon is, the large intestine is, it's connected to the outside as well. You don't think of it that way, but it is. Because if you put food into your mouth, the food just goes through a big tube, and at the end of the tube is the anus, and that's all an open tube, right? It's not closed, it's open. So I know this is not something you usually hear, but this is something that you could, think about if you wanted to. And that whole big tube, the one that leads to the end of the colon, all the tube is called the common integument. That's the name of that tube. So there's a lot of these systems that people who study anatomy and physiologists and sometimes biochemists and doctors who are interested in this kind of thing will look at. So they're looking at that. They look at the stomatic-gnathic system as well as being related to the head and the neck and whatnot. At any rate, getting back to the acne, if a person's toxic and they can't detoxify properly, they'll often have skin conditions, and acne is one of the most common ones. So I was eating a lot of foods that weren't healthy. I was eating quite a bit of sugar, a lot of rice, pasta, and pizza, and I ended up with really bad acne. I had the typical American diet, the standard American diet, the SAD diet, S-A-D, the standard American diet. And it wasn't killing me, but it was certainly causing me problems. And I was allergic to some of the things I was eating. Nobody had identified these food allergies before. Medical doctors like my father didn't really think much about food allergies. The focus was far more on, what drug does this guy need? Let's treat it with drugs. Because if you go to the medical doctor, the only real three therapies you have are drugs, radiation, and surgery, or maybe a specialist who uses drugs, radiation, and surgery, or they use sound waves, or they use lasers, which is similar. Sound waves to break up certain things like gallstones and kidney stones. So you don't really have a lot of options therapeutically. When you see somebody like myself, who's a holistic healthcare provider, who provides structural, chemical, and emotional therapies to get to all the hundreds and millions and thousands of causes of acne, you have all kinds of options available to you, and no wonder we're getting better results than the medical doctors are with the chronic condition. So at any rate, I ended up going to all these different people. I went to a dermatologist and I went to different people. They gave me the Accutane, but it really messed me up. My health suffered. And then I ended up needing to find somebody who could help me to no longer be so toxic and not be able to think clearly. And, I literally was having chronic fatigue syndrome along with all kinds of other problems, even though my acne had gone away. So this has been a long introduction to how we help people with acne. I hope you found it helpful. I hope you found it valuable. And I hope you take action so that you can apply some of these things. And the way to take action would just be to contact us at, well, just fill out your name and your email address. It'll be there, or there. Somewhere near here, it'll ask for your name and your email address, possibly your phone number. Fill all that stuff out exactly the way it asks for it. If we don't call you, you can call us, but we'll contact you then, and we can set something up, or we can figure out if we can help you with your acne. Like we have hundreds and thousands of people before you. Well, thousands of people, not hundreds of thousands, but thousands, because it takes a while to help 1,000 people with their health. So thank you so much for watching this, and we'll look forward to seeing you soon.